external border.
This is Danny's consent form.
Aortic valve for the
I'm gonna check my
sorry,
chart.
S2.
I'm gonna gather my equipment.
Hi.
Hi, Danny. How are you doing today? How are you? I'm your student nurse, Samantha. I'm gonna be giving you a physical assessment. All right, I'm gonna close this for privacy. Okay. I'm gonna wash my hands. How are you doing today?
Good. How are you?
Okay. Can I have your name
Danielle Ford,
and your date of birth?
11/7/87.
All right. Do you know what you're here for today?
Assessment.
You're here for an assessment. So I'm gonna get started. I'm gonna check your pulse. Okay, your pulse is strong. And while I did that, I checked your respiration. And do your blood pressure.
It has a 4 report. I'm just trying to find out what it is. Okay. So the first place is going to be the aortic, which is the second intercostal space on the right.
Blood pressure is good.
Left. On the right.
right.
Okay, so
Alright, let me check your pulse.
What's right here?
We're gonna put the pulse ox on there. Your pulse ox is very good.
Remember, the
Check
heart
your
is on this
temperature.
side.
yeah.
You're gonna have
Alright, I'm
one
gonna have you stick out
Yeah.
your
ropes
chin
point on this side.
underneath your chin.
Mitral and tricuspid.
Tricuspid. The aortic's on the right.
Yes.
Okay.
Everything else is on
Is on the left.
Alright.
So, but you normally start with the aortic.
I mean your
So, I start with the aortic.
Alright, so I'm gonna ask you a few questions just to check
intercostal space.
your mental status. So where are you today?
Metro Manic
The right side.
Alright, and what is your
Sternal
name?
border.
Danielle
Just
Ford.
Do you know the date?
Second
intercostal space on the right side of the sternal border.
Alright, you're
I'm listening for
oriented.
this one side.
Now I'm going, you seem
S2.
bright and pleasant.
S2. S1 is the right.
So that means you don't need a mini mental
Okay.
scale, exam
Okay.
or a
So that would
glucose
be,
scale.
I'm listening for the
Alright.
aortic.
So I'm going to assess throughout this
Aortic, I'm listening for
assessment
S2
your
at the
cranial
aortic.
nerves, olfactory being your nose and
Second
smell,
intercostal space.
optic being your eye and optic
Right.
fundus,
Sternal.
your oculomotor, which is your eye
Right.
movement,
Gonna be right
your
there.
trochlear, which is also your eye movement,
Then I'm
your
gonna listen
trigeminal, which
to
is your facial,
the
abducens,
harmonic,
which is
which is
another
gonna
eye
be
movement,
second intercostal
facial,
space,
which is your facial expressions,
on the
your
left,
acoustic, which is your hearing,
which is across from
your
And
glossopharyngeal, your
then
swallowing,
underneath it's gonna be
vagus,
the-
which is your gag reflex, your accessory, which is your shoulder
No, I'm looking at my
shrugging,
belly.
and your hypoglossal,
Okay,
which
so
is just
aortic,
sticking out your
harmonic,
tongue.
and then it's gonna be
Okay,
your
we'll start with inspecting your head.
mitral.
No,
No,
that's the last one.
mitral's bottom.
Yeah.
Under the, yes.
All
Earth
right.
point.
I'm
Earth
just gonna
point.
put these gloves
And
on. And I'm gonna
you can hear
touch
S1
your
and
head
S2
and
here.
just to see
Yes.
if you have
Okay,
any
Earth point.
bumps or bruises
And
on
that
there.
is
Have you
the
had any
third intercostal
head
space.
trauma?
Right.
And,
On the left. And then the tricuspid is the fourth. On the left. And then
Let me know if you feel any pain or discomfort.
clavicular line.
No, this is the sternal border.
Face.
This is the sternum.
Alright.
Mhm.
That's the sternum.
Yeah.
Alright. Do you wear glasses or contacts?
I have contacts.
You wear contacts. Are you wearing your contacts right now?
I was thinking,
Alright.
Oh, okay. The boob is the mid. Okay. Okay. So
Your eyes.
the mitral's gonna be right
hold on,
here.
I'll lay down.
Yeah,
That's where you got it.
Because I'm trying to get it in my head.
All right.
This is a
So
lot
I'm
to
just
put
gonna
together in my head
Look
here.
in your eyes.
I mean, I know we've already gone.
Alright. Other eye.
So,
I'm gonna look and I'm gonna
aortic. We're gonna listen for S2.
Alright.
It's gonna be on your right hand. It's second.
I'm gonna check your
intercostal
ears.
space, right
Have
hand
the
side.
equipment without knocking things over.
Right. Right.
Good.
Right.
Sternal.
Alright.
Sternal border.
And then it's the harmonic, which is on the second intercostal space.
Alright, I'm gonna put this in your ear and I'm gonna move.
And then
Alright.
it is the earth point.
So in those exams I saw
Third intercostal.
in your eye and your eyes look clear. And in your ear, I saw your
Oh, you know
tympanic
what we forgot
membrane
about?
and it seems clear.
respiratory.
All right, so I'm gonna have you stand up for me and check your gait.
In the
And
All right, can you walk towards me?
we could do that before we
All
do
right.
this.
that works.
Can you walk backwards?
Okay.
All right, I'm gonna stay.
Thank you.
I'm thinking, shut down.
So I'm gonna check your perla. I don't have my pen light, so I'm gonna use the light from this. All right, I'm gonna shine this in your eye. Let your pupils contract.
Okay.
They react
Are you
equally to
recording?
light.
Yeah, no,
Okay. So, no, it's just before we do.
Okay,
we're
so
doing
I'm
the,
going to put this, and you can you follow this with your eyes?
Tachyphrenitis.
yeah.
That's where I have my fingers like this
I
and you
don't
breathe
like,
in.
yeah, I don't like that you
All
brought
right,
this to the
thank
camera.
you.
Oh, okay. Well, how would I?
So I don't notice any nystagma,
this.
no lid
Or
lag
you
or
can come
pyrosis.
here.
Oh, yeah, I
And
just.
just,
All right,
I
your
could another
ears
you know what can we do?
are at
Because your back was to the
level
camera
with your
when you were listening
eyes.
The other time.
All right, do you have
We
any
can-
We can
earaches
start
or,
from when you're listening to the back, but you
No,
to
no,
come
no.
around.
all right,
and
do you have any
Oh,
congestion
okay, so
or
that way we
anything?
can see it.
Can I
and
have you
cover it.
plug your nose
Okay,
and breathe
Now we
in
can just cut and splice.
and breathe out?
Okay.
Can I have you plug your other nose, breathe in
So
and
just
breathe
listen
out?
to the back sound again and
All right,
then
I'm
just
gonna
do
check your
the-
sinuses
the
now, so I'm just gonna be
tachyphrenitis.
applying pressure.
And
Let me
then the
know if there's any
expansion.
pain or discomfort.
I'm getting confused.
Anything?
Is this the tachyphrenitis?
No.
Or is that the broad
Okay.
contraction?
This is a tactile from us.
Thank
You
you.
say, okay, can you?
Oh, that's the
All right,
99.
can you open your mouth for me?
Can you say 99?
Okay,
All
99.
right, the color is
99.
good.
Okay,
I don't
that's
see
why
anything,
99.
no ulcers,
Okay.
cracks, and
And
your
then the
lips
other
do not
one's
seem
the,
too dry.
Expansion.
Your
Dynamic-
your membrane
dynamic.
is pink and moist, and your gums look very healthy, and I don't see any cavities.
So I think that's it.
Okay.
Good. All right. So I'm going to check your neck.
Okay, so I'm gonna listen to,
All right.
the
So I'm going to
lungs,
check your lymph nodes while I'm here.
from your back. I'm gonna
Any
lift
pain or
your shirt.
discomfort when I do this?
I apologize.
No. All right. Let me check your thyroid.
Lift your shirt up from the back.
All right. Looking at your skin, I don't see any lesions. Your color is consistent. Let me see your arm. Your temperature, you're not too hot, not too cold. Maybe check your skin sugar.
So the lungs
All right.
are
I don't notice any
narrow and
edema or anything of that sort.
and now I'm gonna
Your
check
capillary refill is
diaphragmatic
it's good.
expansion.
I don't notice
So
any
I'm gonna
clubbing
put my
or
thumbs on your back, and I just want
anything
you
of
to,
that sort.
breathe
I'm gonna check
in
your
and out.
axilla. Good. Your hygiene seems good. It seems you take care of yourself. You don't seem depressed of any sort. So, do you smoke? Do you use any tobacco products?
Nope.
All right. I'm gonna inspect your
So the
breathing.
diaphragm is expanding equally bilaterally with a good amount of expansion.
I'm gonna put this to your chest.
Also now
It might be a little cold.
the tactile premises.
Can you slide that over
Mhm.
again?
Yeah.
Sorry.
Sorry,
It's
no
just
breathing.
one, no, it's just one.
What?
It's, you just put it where the diaphragm is.
You just do one. You don't have
You
to go all
just
the
do
way
it,
up. Okay.
yeah, because
Okay.
the diaphragm is just down here, it's not
Okay, so
all
I don't
over.
want to go any out.
I got you.
Let me
Do
try
that
to
again.
erase that last one, so we don't have it.
All
Too
right.
much we have to erase.
I'm gonna go to your back.
Make sure before I erase. Whatever it is. Okay. So we going?
Yeah.
Because I don't want to erase anything we actually got that's good. Gotta keep it.
Okay. and
All
if you
right.
can just-
I don't notice any
just do it once
bronchi,
right
cackles,
here,
or
and that's
wheezing.
just the tactile
Do you have any chest pain?
No, that's diaphragm.
Any difficulty
And
breathing?
then when
Nope.
it goes
No.
out, I just say that.
All right.
And then, I'm
Well,
gonna have you,
let me
when
listen
I-
to your heart
Okay,
sound.
have you say 99,
I'm gonna have you say 99.
and then that's the one that you do, so
Yeah, and do you go like this up front, or it doesn't matter?
it doesn't matter, I guess, as long as you feel.
Because I thought it was supposed to be in between the.
All right.
This way.
I'm gonna
this
lift your
way?
shirt.
I've
This way.
been doing it.
I do it this way.
This way. Okay. Well, but that's what you guys do. That's what I'm gonna do. Okay.
Do you mind if you?
All right. I heard your S1 and S2. I did not hear your S3 and S4. There's no
My daughter
murmurs.
was doing it for me.
All right. I didn't hear any. I didn't hear any abnormal sounds. I'm gonna listen for your
My
cardiac
voice
rate.
travels.
If there is some.
Oh, that's fine. I have my outfit if you need me as a
Cardiac rate noted. I'm gonna have you lay down and I'm gonna check your pulses. We wanna make sure it's recorded. Check your chest
Okay.
oil.
Record button, so that way it just, that way she
Check your
doesn't have to
carotid.
be.
Yeah, we're worried about not.
Are you looking at this?
She was.
I was kind of in the background.
Yeah.
Check your radial. And the pulmonary.
Tell me when you're ready. Where are you starting from?
I'm
So
gonna check
we're
it femoral.
redoing the back here. I was going to check her lungs on her back, and then we're gonna do the dynamic expansion.
And it's down here, like
And that's your thing. This, right?
there.
Dynamic expansion, yeah. And
Control
then,
here? This?
yeah.
Alright,
Yeah,
let me check your toes,
Then
capillary.
it should expand a little.
Like equally.
Sorry.
Alright.
And then also, then it's that
Check your capillary.
Tactile from its head.
tactile from the
I would say that.
Is it tactile?
From my, I don't
Let me
know.
check your other capillary.
Tonsillitis.
From a titus. Okay, tactile
Alright,
from
capillary
titus.
refill.
Okay.
Well, it might be from my.
I don't know.
From my.
From my or from it.
Alright.
From
That's
its-
the end of your assessment today. How do you feel? Alright, thank you.
I'll tell you when.
Put your bed right up.
I don't think
Kidding.
Okay, go ahead.
Yay.
So